So welcome everybody, welcome to Winncare's webinar today. We're going to be talking about why a focus on post-fall management makes sense. And obviously with that we'll be safeguarding, looking at how we can safeguard residents, reduce musculoskeletal injury in care workers. And one thing that everybody wants to know, that obviously we're going to be saving the NHS millions of pounds annually. Okay, so to give us a bit of information about us, myself, my name's Daniel Colcliffe. I'm the Head of Strategic Partnerships at Winncare UK. You do have my details there, so obviously if you do want to have any information about this project, again, please do obviously drop me an email. Winncare, you probably know us from previous guises as Mangar Health, and we've been designing and manufacturing lifting equipment since 1981. Every frontline ambulance in the UK carries our lifting cushions. We also sell to emergency services across the world, Australia, North America, and across the whole of Europe. Now, we've been working closely with CCGs and health boards since about 2019, when the Welsh Government, as you can see some of the project titles there, put a lifting cushion into every single residential nursing home across the whole of Wales. We've got a white paper that was written by Dr. Mark Hawker. It studies the results of CCG projects implemented over the last 3 years and highlights why a good post-fall management system safeguards residents, empowers care staff to make good decisions, and it reduces, again, I reiterate, reduces costs towards the NHS. Now, partnering with the CCGs and health boards has delivered on 3 key outcomes, or 3 big ones that obviously we like to talk about quite early. And one of the big ones that I always think is a reduction in long lies, removing the amount of time that somebody is spent on the floor, and obviously floor waiting for an ambulance to be able to turn up. It's a reduction in avoidable hospital admissions, so residents remain in their own home, unless care is really needed, and obviously they do need the intervention of the acute setting. And again, really to go back to the same, it's a cost saving to the NHS, reduced ambulance call outs and conveyance, saves the NHS again millions annually. Now, what's your biggest challenge around residents' falls to care homes? Again, Dr. Mark Hawker's report on achieving better outcomes using post-fall management tools, he identifies the size of the problem within a care home environment. Falls are a common occurrence or a serious concern for older people and their caregivers. 1/3 of people over the age of 65 and half of those aged 80 plus, they fall at least once a year, with many of them, unfortunately, experiencing recurrent falls. And again, there's also some data there. Now, the rate risk of falls for care home residents increased by up to 3 times from that of their community dwelling peers. And unfortunately, care home residents are 10 times more likely to sustain an injury as a result of a fall. In care homes, it is estimated there are between 600 to 3,600 falls per 1,000 beds per year. And given that there are over 450,000 care beds across the 15,000, I think it's even more now, plus care homes registered by the Care Quality Commission, this equates to, again, you can see phenomenal numbers, 270,000 to 1.6 million falls per year, and a very large number that obviously you have the ability to be able to manage. As one of the most frequently reported incidents or accidents among residents, falls represent a pressing issue for providers of care as demand for places is expected to rise and obviously population continues to age. Now, why ambulances are routinely called to lift uninjured residents? Given the proportion of falls that do not require ambulance service intervention, there is clear potential that obviously solutions that can help care home staff to assess risk and assist a resident up safely following a fall is obviously paramount, or is obviously needs a lot of action. Now, the Welsh Ambulance Service Trust, they found that 50% of all their calls So as you can see there, 62,500 falls-related calls attended by their crews did not require hospital conveyance and were not related to a serious injury. Additionally, the South West Ambulance found that 70% of non-injurious falls did not require an ambulance response. Although a large proportion of falls are non-injurious, avoidable use of emergency ambulance services for falls in the care sector is high. A study of 32 independent care homes in northwest England revealed that the most common organisational response to a resident fall incident is to call emergency services for an ambulance, regardless of the level of injury sustained. This is not surprising, given that the care home staff may lack the confidence and/or skills to assess a resident for injury in a systematic way and safely and effectively. In terms of management, a care worker may be allocated one-to-one to a resident on the floor, and if the care home only has 2 or 3 staff on shift, that's a significant reduction in staff who are available to meet the needs of obviously the remaining residents within the home itself. And obviously, without adequate support and means to lift a resident quickly, an ambulance call out, unfortunately, is inevitable. Now, obviously, average wait time for an ambulance across the UK is 4 hours. However, and again, unfortunately, anecdotally, the longest we've heard of, the amount of time or the response time is 36 hours for an ambulance to attend. Obviously, something that's no one's fault, but obviously we need to address this time. Now, a long lie, as a result of being people left on the floor for long periods of time, that can have serious consequences. In some respects, it can be the most serious consequence of the fall itself. If it's your policy to call an ambulance when a resident falls, it's likely you've experienced long wait times. But could there possibly be a different way that you do manage falls within the home? But ensuring a timely response to falls is important, particularly for those who are unable to remobilise or get themselves back up independently. Long lies, or again spending a long time on the floor, getting up or being lifted are common among care home residents. For an older person, long lies are associated with further consequences, including tissue damage and pressure sores. I'm sure you well will know if somebody's on the floor for a long period of time, people can acquire a pressure wound within 10 minutes. But obviously you've got dehydration, hypothermia. I will try and pronounce that, but excuse me if I've got a bronchopneumonia, an increased likelihood of obviously hospital admission. Alongside obviously all of the physical complications, emotional, psychological harm that may be endured, including a heightened fear of falling, and again a loss of dignity, and as to how people do manage falls. Now, it is estimated that 60% of individuals that experience a long lie are likely to fall again. Unfortunately, will be hospitalised within a year as a result of the first fall. Now, ensuring a resident is picked up off the floor is therefore incredibly important, and it is one of the promoted through tools to support care home staff in managing falls, such as a React to Falls resource. Now then, the health assessment, the tool ISTUMBLE. This is obviously what we'd like to discuss and promote. It empowers care home staff to make an informed decision about when it's right and when it's wrong to get someone up following a fall. Lifting the resident, it says there within 1 hour, but obviously the sooner you can get someone up, the better, to try and avoid that long lie. ISTUMBLE helps or assist carers to decide when it is to lift and when to call an ambulance. Now, Winncare or Manga Health, as we were previously, we collaborated with the Welsh Ambulance Service to develop the ISTUMBLE app, which is an algorithm and is used to determine the appropriate course of action in the occurrence of a fall. It provides care home staff with clear instructions of when to call for an ambulance or when to use aids to lift somebody up from the floor. It's beneficial to the residential homes who may not have clinical staff available or even staff itself in the case of nursing homes. Residential care staff may also lack the confidence and or skills to assess residents. And by using ISTUMBLE, it offers a tool to supplement the existing knowledge that you always have. Like when we talk about ISTUMBLE, everybody knows about, so, well, I'll do this already, I know that. But again, it's just having that physical tool there in front of them to be able to say, yes, fantastic, I've checked it, I've gone through it. And one thing that we do know, and as it says there importantly, we know that ISTUMBLE, it's been demonstrated, and we know that it reduces the length of time that residents are on the floor. More than 20,000 care workers now use the ISTUMBLE, and again, I think that figure's even higher now. And it's an assessment app to support safe patient lifting and the assessment of the resident once they've fallen. Now, while A&E doctors do support post-fall management and obviously the use of it, Dr. Sue West-Jones, a consultant in emergency medicine, explains here why ISTUMBLE and lifting poor residents quickly is so important. And again, it's a statement she's got here. The reason why she became involved with ISTUMBLE, the project, that it's profoundly positive for the residents of care homes and those who care for them. And she does say that, again, the benefits of lifting a resident off the floor is innumerable. By definition, residents of care homes are frail, otherwise they would not be cared for in the residential arena or the context. Now, with frailty comes a lack of psychological reserve and in strength, and in addition, residents may have multiple comorbidities involving the major body organs: respiratory, lung disease, cardiovascular, heart vessel disease, and renal, obviously, etc., etc. All these comorbidities cause reduced skin perfusion. Thus, when a resident is kept on the floor for more than 20 minutes, the pressure from the floor, especially on a bony prominence, bony area, especially like the sacrum area, further reduces the blood supply to the skin, and therefore an elderly person on a hard floor and even on a carpet will suffer an early breakdown of skin tissues and also development. So again, resorting back to what we were saying earlier about obviously the skin, like acquiring a pressure sore. Now, the most common complications with skin ulcer are increased mortality, osteomyelitis, again, excuse me if I pronounce that wrong, and obviously sepsis, which we know obviously how dangerous sepsis can be. If the patient has sustained a femur fracture during a fall, the chances of mortality from the pressure ulcer are actually higher still because the patient will suffer reduced mobility before and after the surgery. And one thing she does state, in her 20 years of emergency medicine, she has never seen an exasperation or damage to a broken femur of an elderly patient who's been lifted carefully and with the appropriate lifting device. Okay, so MSK injuries or musculoskeletal injuries have been reduced by up to 41% when using a lifting device. Regularly lifting a fallen resident without the right equipment can lead to serious back pain and sometimes career-shortening injuries. Moving and handling people, for example, lifting a resident after a fall, has long been acknowledged or long known that it's a major contributor to the high incidence of musculoskeletal injury among healthcare staff. Musculoskeletal injuries occur when tissues are exposed to excessive loads. The persistent and recurrent nature of these injuries increase the risk for sickness absences, as again, I'm sure we've all experienced at some point in time. It is estimated that the MSK symptoms account for approximately half of all sickness absences in NHS staff, the total cost exceeding £1.7 billion annually. And obviously this represents a significant public health management and staffing challenge to be able to overcome. Various interventions have been introduced to mitigate against the risk of MSK injuries. These include the assistive devices for moving patients, employee education, and obviously organisational policies. The use of assistive lifting devices can reduce the risk of back injury among healthcare workers. It's categorical. When reliance on agency staff accounts for approximately 8% of care home staffing costs, highlighting again an apparent financial implication. Again, we've got some information here just to give you a rough idea. I think they are very conservative costs here, but every fall in a care home can cost the NHS up to £1,382 per fall. Avoidable ambulance call-outs represent a considerable time, and the cost burden that could be lowered using ISTUMBLE and one of our manga lifting cushions, as represented below. A total there, you can see there, £1.38 million per year. The multi-system minimum saving from tackling the issue of long lives, as I say, you can see be worth between £553 to a maximum £1,000 per long life prevented. Now, to give you a bit of an insight, we work with many CCGs and health boards across the UK, and this does list several of the ones that we have worked out where they have rolled out considerably across the UK, across their defined footprint. Obviously, I'm not going to read through there, but obviously you can see many, and obviously would welcome anybody to be able to come and join the ever-growing and expanding list of CCGs and health boards to be able to obviously roll out similar projects. Now, in summary, we work with CCGs and health boards to support care homes with their post-fall management policies and techniques. But the initiative, again, what the whole emphasis behind this whole initiative and project is, it empowers care home staff or workers to make good decisions around lifting fallen residents. Using ISTUMBLE, the health assessment app, developers of the digital technology, we provide expert training that safeguards residents and gives care workers confidence and a reassurance that they're lifting somebody correctly on when they should be. It's going to reduce calls to the ambulance service for residents who don't need the onward transfer to hospital, that can be better cared for within the care home and being under obviously the care from the home staff itself. It reduces the impact of the long lie and obviously the wait for an ambulance to arrive. It reduces avoidable hospital admissions. And again, what we'll just read through about going about it protects care workers from injury by the introduction of a lifting device, which will then reduce the sickness costs associated with the MSK or musculoskeletal injuries. Now, just for a bit of interest, this webinar is available to download, and in the appendix there is information on all the lifting cushions. So we have 3 cushions that are available. We have the elk, the camel and the eagle lifting cushions, all of which will be detailed on what they offer and how they can support you. Thank you very much for logging on to this webinar. We'll hopefully hear from you soon.